Good afternoon, everyone, and welcome to Health Reform Beyond the Basics. Thank you for joining us for today's office hour session on HealthCare.gov Redetermination and Renewal process for 2025. My name is Aisat Odiale, and I'm the Health Projects Assistant at the Center on Budget and Policy Priorities, and I will be moderating today's webinar. Beyond the Basics is a project of the Center on Budget. It's designed to provide training and resources to facilitate enrollment in the ACA health insurance marketplaces and Medicaid. The Center on Budget is a nonprofit policy organization. We are not a part of the U.S. Department of Health and Human Services. Beyond the Basics is aimed at healthcare assisters, advocates, state and local officials, and others who help people get and keep their health coverage. This session is not intended for press purposes, and we are not able to offer continuing education credit for our webinars at this time. Webinar logistics. Automated captions have been enabled for this webinar. To view them, you can click on the double CC icon you see at the bottom panel of your screen. Or if you don't see that, you can click on the More option with the three dots at the bottom of your screen. There you should have the option to turn on closed captioning. All participants are muted and in listen-only mode. If you would like to ask a question, you can click on the Q&A icon at the bottom of your webinar screen and type your question into the box. Throughout the webinar, you can upvote questions in the Q&A chat. You do this by clicking the thumbs up icon under a question you like, which will bring the question to the top of the Q&A chat. We will be monitoring questions throughout the webinar, and we are dedicating the majority of the time to today's session to Q&A. And we may not be able to answer every question asked. And if we don't, we will do our best to get back to you after the webinar, and we will have a record of all of your questions that we will use as a guide for future resources and presentations. And of course, you can email your questions after the office hour session to beyondthebasics@cbpp.org. And just a quick reminder that you will not be able to click on the screen to go to any of the links shared in the deck, but I will place a link to the slide deck in the chat where you can access all of the slides and the links that we shared today. So our webinar schedule, here you can see the webinar schedule of our series. And this fall, we've been hosting a combination of traditional webinars and holding office hour sessions for topics where not much has changed. We are at the final stretch of our series with the Enrollment Trivia Challenge being the final webinar of the year. Today's agenda includes around a 15-minute crash course on auto renewal process on HealthCare.gov, followed by a live Q&A session. We've queued up frequently asked questions, and we will also be taking your questions from the Q&A chat. Today's presenter is Jenny Sullivan, Director of Health Coverage Access at CBPP. And we are also joined by Lynn Cowles, Health and Food Justice Programs Manager at Every Texan and former Navigator Program Manager. And Lynn will be helping monitor and answer your questions in the chat. So with that being said, I will turn it over to Jenny to get us started.
Hey, wonderful. Thank you, Ayasat, and thank you everybody for joining us this afternoon. I have a hunch many of you have been with us for most of the webinars in the series, or at least that this isn't your first with us this fall. So thanks for hanging in until almost the very end. And I hope that we can answer your questions, and I hope you learned something today. So before I dive in, just a note that today's presentation will be very focused on the renewal process in HealthCare.gov states. But a lot of the same concepts apply in states with state-based marketplaces, and I'll try to point out where there are things that are like optional for state-based marketplaces or similar in those states. But if you have questions about your state and you're not in a HealthCare.gov state, you can always reach out to us via email afterwards. We're happy to help you work through those questions. So, any conversation about annual renewals starts with the calendar, at least in my mind. Open enrollment for 2025 coverage starts next Friday on November 1st and runs through January 15th in most states, including all HealthCare.gov states. There are a handful of state-based marketplaces that go until January 23rd or January 31st, but most states go through January 15th. People who are currently enrolled in a marketplace plan can start updating their information and selecting a plan for 2025 as soon as open enrollment starts. And people have until December 15th to do this for coverage effective January 1st of next year. Then on December 16th, the marketplace will use the information that it has available through the Federal Data Hub to automatically re-enroll anyone who hasn't taken action and qualifies for automatic re-enrollment for next year. These people will also have coverage effective January 1st. But anyone can choose a plan or change plans anytime before the end of open enrollment. So before I review the technical details of auto enrollment, just a reminder that even though automatic re-enrollment helps ensure that as many marketplace enrollees as possible keep continuous coverage from one year to the next, and for that reason, it is great, we always want to encourage people to actively re-enroll. Meaning that during open enrollment, and as many people as possible who are currently enrolled should go back to the marketplace, either work with an assister or log into their account and update their information, especially their income information, with the marketplace. Make sure they understand their updated advanced premium tax credit amount for the new year, renew the plans that are available on the marketplace, and ensure they're enrolled in the one that they prefer for the coming year. Now, it's important for people to update their information because changes in income and household size can affect eligibility for premium tax credits. A person could also be newly eligible for Medicaid or CHIP, or their advanced premium tax credit amount could go up or down, and their eligibility for cost sharing reductions could change. And even if their income remains exactly the same in 2025 as it was for this year, their advanced premium tax credit amount could still change because the premium for the benchmark plan in their area, and remember the benchmark plan is just our fancy word for the second lowest cost silver plan, the premium for the benchmark plan is unlikely to be exactly the same dollar for the dollar in 2025 as it was in 2024. And that benchmark premium is the basis for calculating the premium tax credit. So even if nothing changes for the enrollee, things change behind the scenes that can affect what they're going to pay in the new year. Plus, of course, it is a marketplace and named a marketplace because marketplaces are dynamic places where things can be bought and sold, and plans and prices change from one year to the next. Health insurance is a very consequential financial decision. It can have a big impact on a household's budget. So really actively renewing is the best way to ensure that everyone in the household gets the correct amount of financial help and is protected from owing back a significant amount of money when they reconcile their 2025 credit in 2026. We also want them to get the most accurate cost sharing reduction determination because unlike the premium tax credit, the enrollee can't recoup those costs at tax time. If you're not enrolled in a silver plan during the coverage year while you're getting healthcare services, you don't get the cost sharing reductions, even if you would have been eligible. Plus, last thing I'll say here, we had a record-breaking number of people sign up for marketplace coverage in 2024. Thank you to all of you for the hard work you did to help push enrollment that high. But we have 5.2 million new enrollees this year who might be completely unfamiliar with the annual re-enrollment process. So helping people navigate that process and helping any new folks that enroll with you this year understand what to expect next year is just a really good thing to keep in mind if you're helping anybody navigate this process. So annual renewal is really a two-step process: redetermination of eligibility for financial help, and then re-enrollment in a plan. First, the marketplace redetermines eligibility for premium tax credits and cost sharing reductions. Or if the person's circumstances have changed, they might move to Medicaid or CHIP or learn that they have a qualified offer of employer-sponsored coverage. And in the active renewal process, this information is going to come actively from the enrollee. With passive renewal, HealthCare.gov updates the enrollee's information based on the information available about the person in the Federal Data Hub. After the eligibility redetermination has taken place, if the person's still eligible for a marketplace plan and financial help, then they re-enroll in a plan for 2025. And if someone is actively renewing, then it looks just like the initial process of choosing a plan. If you're an assister, you can help them compare plans and prices and take into account their updated premium tax credit and cost sharing eligibility, and help them choose from all the plans available on the marketplace where they live. With passive renewal, HealthCare.gov uses its own hierarchy to reassign the enrollee to a 2025 plan. So, first, the marketplace gets information from the IRS about the enrollee's income for the most recent year they have data available from. And from there, the system sorts people into two groups. People the marketplace can automatically redetermine with financial help, which you'll see at the top of the slide with the green line, and people the marketplace can automatically redetermine, but without financial help, and that's the red outline. People in the top group who are eligible for financial help can choose to do nothing, and they will automatically be redetermined eligible for premium tax credits and cost sharing reductions. Their level of financial help in 2025 will be calculated using updated poverty guidelines, the new benchmark premium, and the enrollee's most recent income information. These people can also choose to provide updated information to the marketplace and have their premium tax credit and cost sharing reduction eligibility redetermined based on that new information. And this is the middle orange box on the slide. This can happen anytime during the open enrollment period, including after December 16th, when people have been automatically re-enrolled in another plan. Moving to the folks in red, people whom the marketplace determines are not eligible for financial help, will also be automatically enrolled, but without financial help. Now, this may or may not be accurate depending on the enrollee's circumstances, but they're still going to be on the hook for the first month's premium unless they either cancel the plan or update their information. And they can also sort of level up to the orange box and be considered for premium tax credits and cost sharing reductions if they provide the marketplace with updated information to make an eligibility determination. And a reminder here, which I'll note again in a few minutes, but HealthCare.gov is continuing its policy this year of moving people who qualify for cost sharing reductions, but would be auto re-enrolled into a bronze plan to re-enroll them into a similar silver plan if it would have a lower premium and the same provider network. Okay. So now let's unpack these two categories, the people who are and the people who are not eligible for automatic redetermination. So first, you've got the standard group in green here who have granted the marketplace permission to pull recent tax data, who have updated their application in the past 2 years, who are enrolled in coverage with APTCs and CSRs this year, and who don't fall into one of the special groups that can't be automatically redetermined. Then you have people who are only eligible to be re-enrolled without financial help. This includes people who did not check the box on the application, authorizing HealthCare.gov to use their tax data to update the person's income and household size. This is sometimes called the opt-out group. People who have been auto-renewed for the past 2 years, so for 2023 and 2024 coverage, and for whom there's no IRS information on their income for those years. This is known as the repeat passive group. And people who are not currently receiving advanced premium tax credits and cost sharing reductions. People in any of these groups will be re-enrolled without financial help unless they return to the marketplace to update their information. Finally, as you hopefully know by now if you've been with us through the series this year, the marketplaces are also required to begin enforcing the failure to reconcile requirements again, starting with 2025 coverage. So people who have failed to file taxes and reconcile advanced premium tax credits that they received for 2 consecutive past years, so in this case 2022 and 2023, are not eligible to be automatically redetermined for 2025 coverage with financial help. These people have to reconcile their advanced premium tax credits from those previous years and let the marketplace know when that process is complete in order to qualify for advanced premium tax credits in 2025. They don't take action by December 16th. then they will be automatically re-enrolled for 2025. But again, they will only be re-enrolled without advanced premium tax credits and cost sharing reductions. So what happens if someone in this situation has their coverage automatically renewed without financial help? Well, we know for the vast majority of folks who are getting premium tax credits, it is very likely that they will not be able to afford the full cost premium. So if someone is in this situation and being renewed without premium tax credits, and that makes the coverage unaffordable for them, then it's really important that they cancel the coverage before the end of the year, so before December 31st, so that they're not on the hook for that January payment. If they don't cancel the plan, then they're on the hook for the January premium. And if they don't pay their premiums, then they'll go into a grace period. But they still have to catch up on all the premiums they owe by the end of the 3rd month of coverage in order to stay enrolled. So in this case, play this scenario out, it would be the end of March 31st. If they don't get caught up on those 3 months premiums, then their coverage is terminated back to the last day of the 1st month, so January 31st in this example. And if this happens, they're also on the hook for the full cost of any healthcare services they received during the 2nd and 3rd months of that grace period, so for February and March. And they're still liable for the full premium for that 1st month of coverage. This sounds a little dramatic, but I will say that it's relatively easy to prevent if the person just can actively interact with the marketplace during the first couple months of open enrollment, either to come back and update their information, to state that they have reconciled past premium tax credits if they're in that failure to reconcile group, or at least to cancel coverage into the new year if for some reason they aren't able to provide more information or aren't still eligible for financial help. So how is the APTC and cost sharing reduction eligibility redetermined for people that are getting automatically redetermined? You might recall that the marketplace needs 3 pieces of information to calculate a person's premium tax credit. They need the relevant poverty guidelines for the year, the benchmark premium for the place where the person lives, and the most recent income information available for the person adjusted for the applicable federal poverty guidelines. And of course, we have to do that adjustment because we are re-enrolling or redetermining people who provided income information last year or even the year before. So the poverty guidelines are set. The marketplace uses the 2024 guidelines for the entire 2025 coverage year. And the marketplace also knows the benchmark premium for everybody for 2025. And we will know that information soon too. Likely within a week or so, that information will be posted in the window shopping tool for HealthCare.gov and likely for state-based marketplaces window shopping tools as well. And then for income, there are several potential sources of usable information. And for those, there is a hierarchy. So first, the marketplace will use a person's 2024 projected income if it's available. So that would be, for example, from when the person applied for the coverage that they're currently receiving. If there isn't a 2024 income projection, maybe because the person was automatically redetermined last year, then the marketplace will use 2023 tax data from when the person filed their taxes earlier this year. If neither of these sources of income data are available, then the marketplace will go back to the household's 2023 projected income that they provided when they enrolled for 2023 coverage. The marketplace then will adjust the person's income based on the change between the poverty guidelines used for either 2023 or 2024 coverage, sort of adjusted forward to the poverty guidelines for 2025. And that you would never have to do this calculation yourself. This is just to help you understand what's going on behind the scenes. But those factors are here on this slide as well. And this is just the change between the 2023 or 2024 poverty guidelines and the ones for 2025, which, to make things even more complicated, we're technically talking about the 2024 guidelines, not the 2025 ones, since we use the 2024 ones to calculate eligibility for 2025. So if you're not confused yet, then hang on. We'll get you confused some way or another before the end of this. I made a little allusion to this earlier, but we are going to continue. HealthCare.gov is going to continue the automatic re-enrollment from bronze to silver for certain people. And this is an option for states that run their own marketplace as well. And the idea is to maximize the number of people eligible for cost sharing reductions who actually get them. HealthCare.gov automatically re-enrolls people who would have been auto re-enrolled into a bronze plan, but who are eligible for cost-sharing reductions, into a silver plan if there's a silver plan available from the same issuer that would cost the same or less in monthly premiums and that has the same provider network as the bronze plan that they would have been auto re-enrolled into. Last year was the first time HealthCare.gov took this approach, and it applied to about 250,000 people. So not a huge, staggering number, but certainly and hopefully impactful for the people who got into plans where their out-of-pocket costs would presumably be lower if they were accessing care. If people don't like the plan that they've been auto re-enrolled into, just like any other auto re-enrollment, they still have until the end of open enrollment to make a different choice. So you're not locked into this, even if it applied to you, it happened and you didn't like the outcome. Now, while I walk through the rest of the auto re-enrollment rules, let's set the bronze to silver reassignment rules aside and assume that we're talking about cases where that new process does not apply. So people are automatically re-enrolled in their current plan if it continues to be available in the coming year. Pretty straightforward. If you can just stick with the plan you've got, that is what the marketplace will do for you. If the same plan isn't available though, then the marketplace will re-enroll the person in a new plan offered by the same insurance company that's as similar as possible to their 2024 plan. If that's not possible, for example, if the issuer has left the marketplace, it's no longer participating, then the person will be auto re-enrolled in a new plan with a different insurer that's as similar as possible to the 2024 plan. And the marketplace goes through a fairly detailed and technical process of mapping these reassignments to make sure that they are truly making things as few changes as possible when people are being reassigned to a plan that's not the one they had before. This all happens when auto re-enrollment takes place on December 16th, so that people are into a plan that starts January 1st and have kind of the greatest likelihood of being able to have continuous coverage without any gaps. People still have until the end of open enrollment to pick a different plan if they're not happy with the plan that they're matched with via auto enrollment. Okay, so the special enrollment period when somebody is auto enrolled in a new plan. So if a person's current plan is not being offered next year, then the person is eligible for a special enrollment period. In this case, they have 60 days before and after the discontinuation date to choose a new plan. Presumably the discontinuation date, if the issuer is canceling the plan or exiting the marketplace, is December 31st of 2024. So the person has from the beginning of November until the end of February to choose a new plan. If they use the special enrollment period before the end of the year, then the effective date for that new plan is January 1st. So this is unique. People are in this situation that qualify for this special enrollment period can choose a new plan as late as December 31st and have their coverage effective January 1st. They don't have that middle of the month deadline like everybody else. If the person uses a special enrollment period after their 2024 coverage ends, then the effective date is the first day of the month following whenever they make their plan selection. So if the person makes the plan selection on January 31st, they still get coverage that starts February 1st, or by the end of February, their coverage will start on the 1st of March. Okay, terminating coverage. So we've talked about this a little bit, but HealthCare.gov gives enrollees multiple ways to terminate their coverage if they don't want to be enrolled in a plan that they were auto re-enrolled in. They have to do this by December 31st, or they'll be on the hook for that January premium, unless they were auto re-enrolled into a different plan where a binder payment is still required, in which case if they don't pay the January premium, then their coverage just won't be effectuated. They don't have to actively terminate it. If they take no action, they're sort of off the hook. But people often are not going to know these sort of details and these rules, so best to just be active and engage with the system throughout the process, because people are understandably surprised if they get a bill for a January premium when they didn't take action and they didn't realize they were being auto re-enrolled. It can be a very frustrating situation for people. So again, helping them understand this process if you're interacting with them now, and then people that you're interacting with now who might be new enrollees this year, helping them sort of set the stage and understand what they can expect at the end of next year when they're auto renewing for 2026 is also really important and a really helpful thing that you can do for people. Last thing, remember, if a household needs to terminate marketplace coverage for some people in the household, but not everybody, and this often comes up when you have somebody who is becoming eligible for Medicare, for example. So one person is aging out of marketplace coverage, but the rest of the people in the household still need to keep their marketplace coverage. Always call the call center. Don't try and do that on the website, even if you've led yourself to believe that you can click the right buttons and make it happen. Using the website will terminate marketplace coverage for everyone in the household, and that's not the outcome that you want. So call the marketplace in this situation, and they can help turn off coverage on the appropriate date for the person going to Medicare and make sure that the other folks understand if they're eligible, they would be eligible in this case for a special enrollment period, and how to change plans and not have a gap in coverage as this transition takes place. So with that, I have gotten to the end of my crash course here, and I think we're ready to either go through some of the FAQs that we've come up with here that are things we often get asked, or we can talk about some things that are coming in through the chat. Lynn, let me check in with you. How is the chat looking?
Yeah, we've gotten some really, really good questions. So Molly asked, does the advanced premium tax credit not automatically change when there's an automatic renewal? I did answer that one in the chat, but if you want to go ahead and just, field it for the group here in case anybody didn't have access to the Q&A or anything like that.
Sure.
Yeah.
Sure, and I'll venture a response here, and hopefully it's aligned with whatever you've replied in the chat.
Yeah.
So the APTC is adjusted when somebody's automatically re-enrolled. First, the marketplace looks at whichever the most recent source of income it has for the person is, and then it takes that dollar amount, applies that adjustment factor to determine what their income would be based on the adjustment in the federal poverty level from whatever year that income amount is from, compared to the poverty guidelines that we're using today. And then you use that information to determine the person's applicable percentage, and the applicable percentage is then used to subtract from the benchmark plan so that we can determine the person's premium tax credit amount. And sorry, I feel like these math equations do better with a visual on the screen, but that's sort of walking through the math.
Thanks, Jenny. And then also Nancy just asked in the chat, how and when are consumers being advised of the failure to reconcile requirement?
That's a great point. People are getting notices about that. Actually, they should already have started to get notices if they are either they're getting sort of a warning notice if they have failed to reconcile for one previous tax year and saying, please take care of this, because if you have 2 consecutive years where you failed to reconcile, you could risk losing your premium tax credit. And people who are in the 2-year bucket are also getting a notice about this and encouraged to go back to your marketplace app, like take care of it with the IRS first and foremost, then go back to the marketplace, check the box that says, yes, I've reconciled my past premium tax credits. And then the marketplace is going to go back and sort of check the records with the IRS in January and then again in the spring of next year to ensure that what the person has said they've done has actually happened. And that's called the recheck process. And that's how you sort of clear the failure to reconcile status. But people will be getting notices, and it's both the tax filer who claims the person, if they aren't one and the same, that person will get a notice about the failure to reconcile status, and the person who themselves, their tax credit has not been reconciled, that person will get a notice as well.
Perfect. Thanks, Nancy. And thanks, Jenny. And then here is a really good question about auto enrollment and Medicaid eligibility. So what about the auto enrollment and individuals whose incomes make them possibly eligible for Medicaid? So their information gets sent to their state agency with the changing 138% values each year. So like maybe in 2024, somebody is over 138, so they're in the marketplace, but then With the auto enrollment, their 2025 income is under 138%. So what happens to them with auto enrollment?
Ooh, do you come across this or had you come across this often in your work, Lynn? Because I don't want to give the wrong answer and I'm going to look back at my notes. But if you have an answer to that off the top of your head, please go ahead.
Yeah, that's okay. So Texas is a non-expansion state. So that throws everything a little bit into whack here answering this question, but it's similar to a question that I answered from the chat earlier or from the Q&A earlier, which is what are some reasons that people are ineligible for APTCs? Like why would the marketplace determine them ineligible? And one is for the failure to reconcile issue. And another is if their incomes like for the previous year, we're just right around that 100% federal poverty level amount. And then with the new federal poverty level amounts coming in the next year, it means that when they auto enroll, they're actually not eligible for advanced premium tax credits anymore. So I have a feeling that that's what would happen with the person who's right around this Medicaid eligibility number. So Kathleen, you're right. Their information would be sent to Medicaid to check for eligibility. And then when they get determined ineligible for Medicaid, or maybe they get enrolled in Medicaid, right? Because that's the program that they're eligible for. If you're in an expansion state, then they would get on Medicaid, or if ineligible, they could get on the marketplace, but then the marketplace would retroactively cover them starting with whatever their coverage date would be had they been able to enroll in the marketplace when the auto enrollment happened, which would be January 1st. Just so yeah, I just was about to ask if that makes sense, Kathleen. But Jenny, how about for you? Does that follow?
It does. And I think I'm now remembering that the other thing that we always say in these circumstances is that if a person can ultimately, whether they enrolled in Medicaid on their own or they learned that they weren't eligible for financial help and so they went to Medicaid, if somebody gets enrolled in Medicaid, that doesn't automatically turn off their enrollment in marketplace coverage. Unfortunately, those systems are not as integrated as would be ideal. And so people do still have to come back and tell the marketplace, hey, I don't want coverage for next year. Please terminate my coverage if you automatically re-enrolled me, cancel my coverage if it hasn't been effectuated yet because I'm over here on Medicaid. Some of that will eventually come out or could come out through periodic data matching, but people should take as much control over their coverage process and making sure that these agencies have the right information about them as possible. It just helps avoid headaches later, even though I know it is complicated, which is why anybody getting any of these forms of coverage is lucky to have such smart and talented assisters out there in the community to help them.
Thanks, Jenny. And then I marked another one for you to answer live. Beth asks if someone re-enrolls, like I think the question here is auto enrolls. So if someone auto enrolls, does their coverage have any breaks? Like, will they experience any breaks in coverage?
Yeah, no, that's a great question. Excuse me. For the majority of people, they will not have a break in coverage. They'll just close out the year with their 2024 plan and their 2025 plan will start on January 1st. Let me make sure I don't get this wrong, but for people who, let's say you get auto re-enrolled in a plan either that you don't like and it's different than the plan that you had in 2024, if you don't pay that binder payment, so that first payment to effectuate coverage with a new insurance company or a new plan, then you wouldn't have coverage January 1st. But you would still have until the end of open enrollment to choose a different plan, pay the binder payment, and have your coverage start effective February 1st. So in those cases, you certainly can have a break in coverage. But if someone is just sitting back on their hands, not engaging with the process and letting the system have its way, then they would have continuous coverage. It's just a question of whether they would have continuous financial assistance, which I think is the most important thing and harder to guarantee.
Thanks, Jenny. And then let's see here. Leslie asks a question that I'm afraid will happen at least I think once for every assister during open enrollment. But Leslie's question is about having so many people come into the office saying that they don't even know that they've been enrolled in the marketplace. So let alone they have not received paperwork or an insurance card. And so, Leslie, that's a really important statement. And I'm going to ask a question connected to it that, Jenny, if you could answer or I can answer. But what about those people? Like, what if they come in to enroll and it says that they are not, like, they get the eligibility letter. It says that they're not eligible for tax credits because they need to reconcile, but they've never enrolled in the past.
What do you do in those situations, Lynn? I'm gonna kick
Yeah, so
you.
so this is a really tricky situation, and I mean, hopefully we talk with these people early during open enrollment because it will take some time. Essentially, what navigators or assisters will have to help them do, and if assisters are certified application counselors, you'll probably want to make sure that you're connected to a navigator organization before open enrollment starts. I can help do connections between people across states or within states if needed, but navigators will have to help those people call the health insurance marketplace to get the 1095A that they did not know that they had because they were fraudulently enrolled into a plan. If that's the case, right? If an agent or a broker fraudulently enrolled them into a plan, so they didn't know that they had advanced premium tax credits ever in the past, then those folks will need to get those, the marketplace will need to void those fraudulent 1095As so that then that person is no longer accountable to them. So they can go forward and enroll in the marketplace with tax credits for the first time because they were unaware of those previous enrollments from fraudulent agents and brokers. And that process can take up to a month. So um, you know, it'll be a tricky conversation that navigators will have with the marketplace call center and also with the complex case center. But essentially, navigators can help people apply for retroactive coverage if people are not able to enroll with the start date that they anticipate they can because of agent and broker fraud. But it's just going to take some time. So it'll be important to kind of coach clients and patients and consumers through the process. And if anyone wants to do a deeper dive into what that looks like, please let me know, and I'm happy to hit some of the high points.
Great. Thank you, Lynn.
Yeah. Um,
Um, we had
and then
oh, go ahead.
Yeah, I guess the other kind of stipulation that I wanted to make is that if somebody didn't know that they had a 1095A because they just didn't know that that was part of their marketplace enrollment process, then they are still on the hook for filing the 8962. It's only in those cases of agent and broker fraud where we can call the marketplace and request that marketplace call center reps void the 1095A. So if somebody just like wasn't clear on what they had to do with their taxes after they had marketplace health insurance, then assisters can, do the client education and make sure that folks know that that's part of the process, and they'll have to do that before they can enroll with APTCs moving forward. Um, Thank you. Go ahead, Jenny.
Great. Hang on one second, just doing some behind the scenes technical back and forth here. Okay, so we had a couple of questions I thought I would address next related to people with deferred action for childhood arrivals, or DACA. As people hopefully are aware by now, these individuals for the first time ever are going to be eligible for premium tax credits for marketplace coverage starting, people can apply starting November 1st. And that means that those individuals do qualify for premium tax credits. And if people qualify, they submit an application, get an eligibility determination that says they're eligible for premium tax credits. They choose a plan that starts December 1st, 2024. We know that this is, again, not the solution that works for everybody because 1 month of coverage doesn't give you much time to meet a deductible if you have one, and can be, just can be kind of problematic from a cost sharing perspective. But that won't be true for everybody. And some people need services in December. So by all means, come in, choose a plan, have coverage that starts December 1st. And if you're enrolled as of December 1st, then you will be covered as part of that auto re-enrollment for 2025 coverage. That takes place on December 16th. So if you're in the door by the middle of December, then you get sort of batch automatically re-enrolled for the 2025 coverage year. If they do want to change plans, maybe they made a specific determination knowing they were only going to have 1 month of coverage in 2024, but they want to reconsider or think about a different plan design that works better for them for a full year of coverage, then they can certainly come back in and actively re-enroll, choose a different plan for 2025 if they would like. So I'm going to mark those ones as done here.
And another DACA question,
Yeah.
Jenny, is do DACA clients qualify for APTCs?
Yes, yes, they do, or they will, effective November 1st for coverage that could start as early as December 1st. And I see that there's a related question about just do immigrants in general qualify for APTCs, which is a very important question and not one that's easy to answer in a few succinct sentences. But I will direct you to, we have a written product that goes through the eligibility categories, both for Medicaid as well as for the marketplace, because they are not perfectly aligned. But it goes through which categories qualify for coverage through those programs. And we have a two-part series from earlier this fall, from September, that goes through in quite a bit of detail, both who is eligible for which forms of coverage, which statuses qualify, as well as tips for helping people navigate those situations, because there are a lot of unique things to keep in mind for people who are immigrants. But great question. And we'll see if we can get, maybe if Lynn takes the next question, I can get that resource and pop it in the chat too.
Yes, for sure. Okay, let's see here. Anna asks, what about our elderly with less than 5 years being an LPR and don't have any income, so they don't file taxes? Can they get coverage with the marketplace? Anna, this is also a very complex and very, very good question. So usually for elderly folks with less than 5 years who do have legally permanent resident status, if they don't have any income, then they are generally dependents on somebody else. So it's very rare that elderly immigrants don't come to the United States without a child or a family member on whom they are probably a tax dependent. So generally, what will happen is the children or the adult relative of those elderly LPR, or those elderly green card holders, will fill out a marketplace health insurance application. Because they don't, even if they have an offer in employer coverage, it won't extend to their elderly parents or relatives. And so whoever is the person or the family who are providing the means of living for those elderly green card holders, that family then will fill out a marketplace application and use their own income and their own household structure to apply for marketplace health insurance for those elderly green card holder relatives. And so what would happen is, say you have a family of four and they have two green card holder grandparents who come to live with them. And so they would fill out the marketplace application as a family of six, but the four people who were maybe covered by employer insurance and or Medicaid for the children or what have you, an assister would mark them on the application as not applying for coverage. And so only the green card holding grandparents would be applying for coverage on that marketplace application. And they would get tax credits based on the income of the income earning members of the household, whether it was, one of the parents or both of the parents, if there are two parents in that household.
Great. Thank you for that.
Yeah.
And now I'm gonna, there was a follow-up question from Hannah here. If I have someone needing insurance as soon as possible, if they qualify for special enrollment, could they choose a plan in November that starts December 1st and then choose a 2025 plan too? So from an eligibility perspective, yes, they can choose their plan that starts December 1st and, by the end of November, coverage starts December 1st. They should be able to also actively select a plan for 2025. But this is why it's so great to have Lynn here. Tell me if that has worked for you in the past when you're interacting with the HealthCare.gov interface, if you remember.
Gotcha. Thanks. Sorry, I was answering another question, so I'm just going to go back to Hannah or Hannah's. So if someone needs health insurance ASAP, qualify for special enrollment period, November starts December 1st. Oh, gotcha. Yeah. So what you need to do in that case, if you have a special enrollment period and you fill it out for 2024, then you'll need to fill out another application for 2025. So what you want to do then is, as long as your appointment is within time constraints where you're not like hitting information overload or anything, you'll fill out a 2024 application for the 2024 special enrollment period, set up your December health insurance plan, and then fill out a new application for 2025.
Perfect. Thank you. So you can do it in one sitting, if you will, but you have to fill out both applications, of course.
Exactly.
Okay. I see where there's a lot more coming in. I'm going to buy Lynn some time to finish the one that she's typing in, and I'm going to answer some of the ones that are on this slide just to provide those answers, and then we'll get back because I think we'll still have some more time for ones in the chat. So the first one here is, if a person is not currently receiving premium tax credits, will they still be automatically re-enrolled? And the answer to that is yes. People who aren't getting financial help will still be automatically re-enrolled for the next year as long as the marketplace has enough information about them to do this. If the person wants to be considered for financial help for 2025, then they would need to return to the marketplace and provide updated financial information. Similar, if a person is automatically re-enrolled without premium tax credits, what do they need to do to cancel their plan to avoid having to pay the January premium? They can log into their HealthCare.gov account and click the blue Stop Coverage for 2025 button by December 31st to avoid being on the hook for those January premiums. And if they're auto re-enrolled into a plan from a different issuer than the plan that they had in 2024, for example, because the issuer is no longer offering plans in the marketplace, then if they don't take action and don't pay the first month's premium by January 1st, then their enrollment won't be effectuated. So they don't have that, they won't have paid the binder of payment, so the coverage won't go into effect, and they will be off the hook for that one. We talked a little bit about this Medicaid one. You do have to go back and actively cancel a marketplace plan if a person becomes eligible and enrolls in Medicaid coverage instead. That's not something that happens automatically behind the scenes. Oh, and Lynn, I think I'm seeing, oh, there we go. Or maybe that was ISAT. Sorry, we're having some technical things that we're working on in the background here.
But it's been resolved, so all good.
Oh, good. And we can hear you. Wonderful. I'm going to go to this next one, and then we'll pause and go back to the Q&A, the live Q&A. But can a person change plans more than once during the open enrollment period? And the answer is yes. A person can change anytime during open enrollment. And there's also sort of the free look policy that is true in some states. It varies by state, but it means that people, by their state insurance regulations, have the ability to start coverage and change plans if they have not, if the coverage is not what they wanted or expected. We could get into that a little bit more offline if people have questions. I don't want to do too much more about that today, but Lynn, how are we doing on the chat? What else, or the Q&A?
Yeah, let's see here. So if people do their taxes online, like with TurboTax, will they be prompted to complete the necessary APTC forms? And how are people reminded to complete the correct tax reforms? Sorry, not tax reforms, just tax forms. So Sasha, I'm not sure if you mean like leading up to open enrollment or while they're doing their taxes, but I'm happy to answer both of those questions. Or Jenny, if you want to take a break for a minute.
Sorry, yes, go ahead.
Okay, cool. Gotcha. So Sasha, when people are using TurboTax or, H&R Block or OLT.com, any of those IRS approved tax filing programs electronically or in an office like H&R Block. So TurboTax, online taxes, all of those programs ask people who are filling out those forms, did you have marketplace health insurance? And if people check the box that says that they did have marketplace health insurance, then the tax form will auto-populate in TurboTax or in online taxes. Or if somebody goes to H&R Block, or if they go to a volunteer income tax assistance program or a VITA program, then VITA staff using TaxSlayer or whatever software they're using, or the H&R Block software, will do the same thing. So when people are filing their taxes, as long as they remember to answer that question, did you have marketplace health insurance? Then the tax forms that populate for them to fill out will include 8962, and that's the tax credit reconciliation form. Now, just because the tax form 8962 presents itself doesn't mean that the individual will necessarily know that they need their 1095A from HealthCare.gov or from their state-based marketplace in order to fill out the 8962. So the prompting of the form in the tax platform should remind the H&R Block employee, the VITA tax program volunteer, or the individual that's filling out TurboTax or online taxes, let them know that they need to go back to their marketplace health insurance account, whether it's a state-based marketplace or healthcare.gov, and download their 1095A to completely fill out that 8962. Now, the second part of your question, how are people reminded to complete the correct tax forms? those automatic populations of those forms, like I just mentioned, at tax time. But then also, like Jenny mentioned, the IRS will, or sorry, the marketplace will send people notifications now, like right around now, if they have failed to reconcile for 2 consecutive years. So people will get those notifications either hopefully this week or next week or at the beginning of the open enrollment period that says, hey, we've got incomplete information from you and we need you to file your taxes for these past years or amend your tax returns so that they include the form 8962. So there's a couple of different times when people get reminded about that tax credit reconciliation issue. One, when they're filing their taxes because the forms will pop up as long as they answer that question. Did you have marketplace health insurance? And then two, the IRS and the marketplace will definitely let you know before the open enrollment period that if you have failed to reconcile and will not be able to move forward with tax credits until you do either file the taxes or the amendment.
Awesome. Thank you.
Yeah.
I was thinking, looking at the chat and then looking at what we've got left here, one thing we haven't spent a lot of time on is grace periods. And I thought I would do just a quick minute or two about that and then pop our resource in the chat on grace periods, because this is another area where things can get relatively complicated. So people who are receiving a premium tax credit, and you have to actually be receiving it. You can't just be eligible for it. But if you are receiving an advanced premium tax credit, then you get a grace period of up to 3 months, or it is 3 months if you don't resolve it before the end of the third month, where the insurer has to pay for your coverage and any services you receive during the first month, and they can withhold payment during months 2 and 3, but you're technically still considered covered even if you haven't paid your premiums. Now, the enrollee is still responsible for any expenses during months 2 and 3 if they don't resolve outstanding amounts that they owe in premiums on time. And if they don't, by the end of that 3 months, resolve the outstanding premiums, then they lose coverage back to the end of the first month of the grace period, and they're still on the hook for the premium for the January period as well. Now, people who don't get a premium tax credit qualify for a shorter grace period. It's typically 30 days, although this can vary by state. And the insurer can withhold payments during the entire grace period. So people who are not getting APTCs have a much more stringent policy. People can keep coverage as long as they pay all their outstanding amounts owed, including for the months of the grace period and the future month of coverage. So think of it almost as sort of 4 months of coverage that they have to be able to pay for by the end of that third month to keep coverage. And if, let's see, I said when the coverage gets terminated by, if people are automatically re-enrolled, then they're considered to have paid that binder payment. And that means, so their coverage is effectuated, even if they're not aware of what's going on behind the scenes, because auto enrollment can be a little stealthy. People will enter a grace period if they miss a payment for that first month of coverage, or for any month of coverage for that matter. People who actively re-enroll, they still have to make a binder payment in order for their coverage to be effectuated. So they are a little bit more insulated from sort of a surprise grace period situation happening. Also worth noting that if a grace period spans coverage years, so you're in the middle of a grace period at the end of 2024 that bleeds into 2025, the insurer can apply payments made for a New Year's plan to the amounts you owed in a prior year. They can't deny you from enrolling in coverage for the new year, which they used to be able to do. That's a relatively recent improvement, but they can apply the money that's coming in the door all the way back to as far back as the person may have a premium debt. But that's only if the person re-enrolls or is auto re-enrolled into a plan from the same issuer. If the person changes issuers, then the new issuer is not going to apply payments to someone else's debt. So that, just to sort of be aware of the moving pieces there. Do we have any other questions in the chat? Because if we do not, I think we might be about ready to bring this thing to a close.
There is a long-ish question from Rosemary. if in the response history, I imagine in the application history in the Marketplace website, it shows that patients are eligible for Medicaid, then their information gets sent to the Medicaid or to the state agency directly. If an assister follows up on the status with the state and the state does not give any information on the application unless the patient is present, is there another way to follow up on status if it's past the 45 days? Gotcha. I can go ahead and answer this one, Jenny, if that's okay. Rosemary, in general, I imagine there are lots of different standards in each state. So I'll just give like a general kind of overview here. In many states, in order for an assister to contact the state agency about an individual's application, they have to have filled out a permission form that allows them to check the case status of an application. So not necessarily to become an authorized representative on that individual's case, but to become an entity that can check on their case status with the state agency. So if your organization is able to check case statuses because you have that type of partner relationship or accreditation with the state office, then you should be able to check the status of a case without the individual being there with you. And usually there's an online website where you can do it. If you want to pop another Q&A, Rosemary, into the chat and just say which state you're in, I'm happy to reach out to an expert in that state to connect you with them so they can see if there's what's the best way to follow up on the case status. Okay, you're in Illinois, great. Rosemary, we'll follow up then with an expert in Illinois to make sure that you get the info you need about that.
Thank you. And I know just the person we can contact, so
Yeah.
we'll be able to close the loop on that one. With that, I am going to actually turn it over to Ayesette. Thank you all for your questions. And I know we've gotten a few questions about, do you put the answers to all these questions in the slides, or will a copy of the chat be available? And because these are impromptu sessions, more informal office hours, we do not do that. We just don't have the capacity to offer that to you. We've been trying to answer more of the questions verbally, so at least they're captured on the recording of the webinar. But if you have follow-ups or you want a clarification or a repeat of something that you heard today, you are more than welcome to follow up with us, and we will be happy to correspond with you over email to help clarify things. With that, I am going to turn it over to Ayesette to close us out.
Yes, thank you, Jenny, and thank you, Lynn, for today's session. And thank you so much for the engagement in the chat. Here you can see the resources that were presented today and a few extra that is available in the slide deck. Upcoming, our next and last webinar for the year will be the Enrollment Trivia Challenge. It's next Tuesday, October 29th at 2 p.m. Eastern Time. This is a little bit different of a format than we usually do, and a second browser tab or a second device will be needed to play along the trivia game. So you can register for this on the Beyond the Basics website under upcoming webinars. So as a reminder, we will be distributing the materials from today's session via email, and we will post everything to our website at healthreformbeyondthebasics.org. And like Jenny mentioned, you can please reach out to Beyond the Basics for any follow-up questions or any new questions that arise. And with that being said, we will bring this office hour session to a close. Thank you all for joining.